An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
Dr. Ackerman, thanks for allowing our cameras here.
Thanks for coming in and see us.
The Fast Track facelift.
That's correct. It's a wonderful procedure. In essence, we're trying to achieve wonderful, lasting, deep results. By deep results, I'm referring to fixing the foundation, correcting the deep structures, and yet, instead of waiting weeks and weeks for recovery, which typically would take, get patients back up in circulation within a week.
Is this a younger group of patients?
Not necessarily, although we're seeing many, many younger patients coming in for their first facelift, and it is a facelift in a sense. Patients in their 40s don't want to look 40 anymore. They want to look maybe late 30s.
Can you do that?
Oh, absolutely. We can take a 45-year-old woman, perform this procedure, and have her look in her 30s. Okay. And yet, nobody will guess she's had surgery. She'll just look very nice, young, refreshed, and rejuvenated.
Now, most people know you in Newport Beach. You know, talk to people, they know that you're the go-to guy for a natural-looking facelift. Ivy League trained. Impressive background.
Background's very important, but it's not all, of course. You can train in the best places, but you have to have the skills, the talent, the technique, the artistic vision to create specifically what one is trying to achieve.
Now, when I walked in here today, you know, when I hear about Fast Track facelift,
yes,
respectfully, seems very gimmicky.
Well, I had to name this procedure something. It really refers to that our patients are able to return to normal activity within a week.
And still go deep.
And still create the significant changes that I truly believe facelift surgery needs to create. If you don't do the deep changes, you really are shortchanging your patient,
okay,
I believe.
So nationwide, not all surgeons are addressing the underlying tissues. Or they're not aggressive enough?
Ultimately, it's what, if the surgeon clearly explains to the patient what they're getting, the patient's saying, that's okay, that's good enough for me, then it's fine. My philosophy, I get patients back in circulation within a week. Why not give them the best procedure that's available? Best procedure to create vibrant, youthful look, vibrant, pretty face that lasts for many, many years.
So people throw around artist nowadays when it comes to the facelift, et cetera. But I mean, you really see yourself as an artist. And your patients, I've talked to your patients. And if you look at your work, and I'm careful not to endorse guys on my show. I'm just asking the questions. But your work is good. It's
Thank
natural.
you.
It doesn't have the Newport Beach. Everybody says Newport Beach. That done look.
So it is an artistry, and yet it's very unique artistry. Skills involved, artistry involved, visions involved, and then ultimately to execute all that to create beautiful, significant, and yet natural results.
What should somebody look for in a surgeon that's going to, especially deal with the face?
Well, I think the body of work is the most important. You can have someone that's well-trained, even board certified, and yet you ought to look as a patient.
But look at their work.
Look at their work. Absolutely. We all stand on our results.
I mean, you have high volume of before and afters here. I mean, it's a lot of it. It's not just a few.
Well, I've been in practice for many, many years. We have thousands of happy patients, so a wealth of clinical data that I can choose and pick. So we do have a number of very happy patients.
Okay, the hot new lift. You're calling it a fast track lift. What is that?
Well, typically a facelift, if it's done well, namely you create deep foundational changes, would take many weeks to recover. There are a number of lesser procedures available. In my view, those lesser procedures typically create lesser results.
Less results.
You might look a little better for a few months, and then you look about the same. I believe to create beautiful results, you have to do foundational work.
Hey, tell me about that foundational work. Deep.
Basic.
What does that mean to you? What is deep?
Deep implies that a surgeon analyzes patient's anatomy now and envisions what the anatomy was like 10 years ago, 15 years ago. By anatomy, I mean, where's the cheek position? Where's the jawline? Where's the neck? Where's the deep structure? And in surgery, I reposition those structures to really create the young face. Not just tight face, but young face.
I spoke to one of your patients, and I said, is this you? 1 week later. She said 5 days.
For most of our patients that have just fast-track facelift, they're back in circulation within a week. With some makeup,
your lift?
within
I mean,
a
you
week.
came up with this? I mean, this is your design?
I put a number of things together. Ability to do the deep work with decreased trauma to the tissue, preoperative preparation, getting patients in and out of surgery fast, including doing some of these procedures under local anesthesia with sedation,
Okay.
and then getting them back to work within a week.
What's the age range for the fast track?
Well, the wonderful thing about this procedure is that it lends itself very, very nicely to someone in their 40s, whether early 40s, mid or late 40s, somebody that truly has only a week off work, and yet they want to come back looking a decade or so younger. Anyone in their 50s or 60s, likewise, can create significant change, even if somebody has significant signs of aging. And of course, this procedure lends itself to somebody a bit older that might not want to have general anesthesia and yet is willing to go through procedure where they can look a decade or two younger.
So what signs of aging does this address the most?
This addresses the typical signs of aging we see in anyone, whatever decade, 40s, 50s, or 60s, namely loosening of tissues along the jawline, the proverbial jowl, and that's really descent of tissue along the jawline. The whole cheek descends so that you have more of a hollow cheek.
So these two folds, does it take care of that?
Well, absolutely. The fold is just a symptom of a disease, if you will. The fold is caused by the cheeks sliding over. So you need to reposition the entire cheek, not enough to remove a little bit of skin. And of course, the neck. That neck always gives our age away. So if somebody has fullness, loose tissues, and that includes skin, fat, and of course the foundational muscle, all that can be fixed with this procedure. Marla came to see us because she wanted to improve appearance of her face. Of course, on examination, you can see a very pretty, well-balanced face. Nevertheless, there were certain signs of aging that we all exhibit at a certain time. There was more jowling, the cheek was settled down a bit. So I came up with a wonderful plan for her. There's a wonderful new procedure that I do called Fast Track Facelift. That's what this was. That's exactly what it was. It's a procedure where I can create significant foundational changes. To create a beautiful, balanced, long-lasting result, you have to fix the foundation of aging. Typically, when you create those changes, there's significant healing time involved. Many patients are not willing or not able to take that much time off work or typical social calendar. I came up with a procedure where I create significant changes. I do all the foundational work, and yet most of our patients are able to return back to work within a week.
Yeah, look at these photos, and this was a week later, Marla?
Yes. Oh, actually, it was 6 days later.
I mean, you have a huge difference in the jowl area, the neck, very clean. Now, why did you choose Dr. Ackerman? How did you hear about him?
I happened to be at a luncheon. I was covering a luncheon, and there was this woman there who was about 10 years older than me, and she just looked marvelous. And we got to talking, and I told her that she looked marvelous, and she just looked at me and she said, "Thank you, but I've had a facelift." So I said, "Who?" You know, of course.
Yeah.
And Boris Ackerman. So that was it. That was it.
Did everyone at the table
Oh, it just
decide to go to see
into-
Dr. Ackerman?
It got us into a girl talk that I've never had with women before about plastic surgery.
You look great for your age. I
thank
know your
you.
age.
Thank
You
you.
look 10 years younger.
Thank you very much. And that's good. I like that.
Now, Dr. Ackerman, is that the goal? I mean,
That is the goal. The goal is for people not to guess that our patients had a facelift.
Yeah.
The goal is for observers to be very wrong about our patient's age. So you create a beautiful foundational change so this patient looks like she did 10, 15 years ago.
she told me off camera, she said that it even frustrated her that the great facelifts go unnoticed. Do you feel the same way?
I personally don't feel frustrated whatsoever.
Okay.
That is my goal. The goal is to create a
Sure.
beautiful, significant changes, but in a very natural way.